mean, I think that people should know that, and it's just amazing how we don't get the right information out. That how maybe busy doctors, but there's some kind of way when they want us to learn something for sure, they get to us, right?
Absolutely, absolutely, and that's the point. It's, do they want you to know?
Right,
Right. I
right,
mean, they were, the CDC was obligated to do that, but do they really want you to know?
right.
It's almost like releasing, important information on a Friday evening, kind of tucked under a whole lot of other, right?
Right, right, and then all the bad affidavits for famous people come out on Friday at 5
Exactly.
when no one's paying attention.
Exactly.
So there have been all sorts of improvements. I know in the 25, 30 years since I graduated from medical school, they've come a long way with some treatments. I mean, tell me a little
Yes.
bit about that.
Sure. Well, at first it was just hydroxyurea that people knew about. And hydroxyurea is actually an oral chemotherapeutic agent, but it was accidentally found, besides treating leukemia, was found to increase the fetal hemoglobin in a sickle cell patient. Well, in anyone, but it
Mm-hmm.
worked for sickle cell disease because when you're born with one type of hemoglobin called fetal hemoglobin. And then when you're about 6 months, it changes to what we call adult hemoglobin.
Mm-hmm.
The thing about that is that the fetal hemoglobin doesn't have the genetic mutation that adult hemoglobin has. And so if you can increase fetal hemoglobin in an adult, you give them a chance to pretty much operate like they don't have sickle cell disease.
That makes
It's just a matter of who will respond, because it turns out that when they did the study, they they did it with mostly the main type of sickle cell disease and not the other genotypes. And
mm-hmm.
so some people will respond, and even within the main genotype, some people will respond, some people not. But for the people who do respond, it's life-changing, and it also has been found to prevent some of the complications that can happen with sickle cell disease as you grow. So it's not just therapeutic; it's preventive, right? And so that was wonderful, but not everyone, was helped by that. And then the next that came down the pipeline was something called Endari. Endari was a very naturally occurring um, essential protein or essential amino acid in the blood, L-lysine.
Mm-hmm.
And so they were able to make large amounts of it and concentrate it and give it in a pill. And that actually did exactly what hydroxyurea was doing, but in a more natural way. And so many people responded to that. That was the first time that something was specifically made for sickle cell disease, and that was awesome. And then, again, because people are so individual, some people responded really well to it, and then some people were hit by the side effects before the effects ever kicked in, and so
Right. So they
right,
didn't stay with it.
right, and so
Mm-hmm.
they couldn't hold on. So after that, in 2019, and I will always remember because I remember where I was when I found out that another sickle cell medication came out, and it was by a company called Global Blood Therapeutics,
Mm-hmm.
and it was called Oxbryta. It is called Oxbryta. So it was actually called I'm sorry, Voxelotor at the time in trials, and it came out and it was rebranded as Oxbryta, and it's in pill form. You take it. It also, well, what this one does is that it increases the affinity towards oxygen. So
Mm-hmm.
And so because you can be more oxygenated, or the sickle cell can stay in an oxygenated state, it prevented it from sickling as much,
Oh,
right? So it's only when the hemoglobin is deoxygenated that it can sickle. So if you can find a way, and with hemoglobin, it can hold on to four oxygen molecules. I might be getting too detailed here, but this allows for at least one to stay on while three gets released into your tissues to oxygenate your tissues. But if it could hold on to one, it can still stay in the oxygenated state, and so it prevents it from sickling. And so because it was not causing as much damage and so on to the red blood cells, it also increased the hemoglobin count. So people that were severely anemic were getting 2-3 levels higher with
wow.
just Oxbryta. So that was awesome. And so that was better for people who had low hemoglobin, but for people who were higher hemoglobin, it was not the best thing, because it could put you too high and then cause viscosity, right?
Right, right.
Hyperviscosity, and then that could put you at risk for all kinds of things as well. So it helped a range of patients, but not everyone. A week apart they came out. The second one was what's called Adakveo now. At the time, it was called crizanlizumab, and everyone was like, "Say that 3 times."
Say it once, right?
It's crazy. So crizanlizumab came out, and it became Adakveo, and that was by another company, Novartis. And so then that one was an infusion, and that's the one I'm currently on. So that's
Mhm.
a once a month infusion. All of these things have their side effects and benefits and side effects, and so it's a matter of managing that.